Hello,
Hello,
how are you?
I'm wonderful. How are you?
We are fine here. How are you on the other side?
Uh, things okay. Yeah.
Can you see us well? Can you see our patients?
Yes.
All right, my name is Dr. Kavir. What is your name?
Alex?
You are what? You are Alex?
Yes.
Oh, Dr. Alex, it's nice meeting you today.
It's nice to meet you too.
All right, you can see our patient. Her name is uh, Salama Salman. This is her
Alright.
mother that brought her to the hospital today.
Alright.
All right, Salma is 5 years old, a preschool children, a preschool children. Sorry, a preschool pupil, child.
Okay.
All right. You want to ask any question? You want to ask anything? You're free.
Yeah, could you ask them how they're doing?
Okay. Wai yana tambayar ku ya kuke? The mother is saying she is fine, but her daughter is sick today.
Okay. Could you ask them what symptoms brought them in today?
Wai me yake damun yarinyar kin? Wai that the patient has fever and cough.
Okay. Could you ask them if the fever's constant or intermittent?
The fever is intermittent.
Okay.
She has intermittent fever.
Alright. Does she have a headache or a runny nose?
She had headache and running nose, but the running nose has subsided now. She has only cough.
Okay. So could you ask her how long this has been going on?
Her fever has been on for the first 2 days.
Could you ask them if they've been to the hospital or had any injuries or illnesses recently?
No, she doesn't have any illness or injury in the first 1 month.
Ask about sore throat or stomach ache if she has sore throat.
Wai tana da complaint na makogwaranta yana mata ciwo ne? Eh? Okay, the mother said she doesn't have sore throat.
Okay. Does she have a stomach ache, nausea, vomiting, diarrhea?
Wait, the mother said she doesn't have stomach ache, no diarrhea or vomiting.
Okay. How has she been eating recently?
The mother said she has not been eating since the onset of this illness 2 days ago.
Okay. Are you able to check for an enlarged liver or spleen, like her abdomen?
All right. So, Salma, ki kwanta ko? Kanki a nan wai yana so ya duba cikinki ko? So, let me ask our patient to lie on her back so that we check for the liver and spleen. It's
Yes.
all right?
Yep.
Can we check that? It's all right.
Yep.
Which one do you want us to start checking for? Do you want us to start with the liver or with the spleen?
The liver.
You want us to start with the liver?
Yes.
On which side of the abdomen do you want us to check for the liver? Ki
Right.
kwantar da ita da kyau ki ajiye ta. The right side, all right. Ai, ke ki dan sauka, baki batta ta kwanta flat. Sorry, let me allow her to lie flat on the bed. So kwanta ko Musalma, sannu. All right. So we should start checking from the right side of the abdomen. Yes, you know liver, when it is enlarging, it is on the right side, it enlarges downward. So we start from the lower side and then go upward, trying to see with my fingers whether I will be able to hit the liver. You can see this is the right costal margin, the lower side of the ribs. You understand?
Yes.
So there is no liver here. I cannot feel anything. So that means the liver is not enlarged. Okay?
Okay.
You want us to check the spleen? How do we check the spleen? How do you want me to do that?
Check
Is it also on the right side or the left side?
the left side.
All right. You know the spleen grows from the left side to the right iliac fossa. That is the right side. It grows across the abdomen. So I will start checking from this right side, going upward towards the right upper quadrant, trying to see whether my fingers are going to hit the enlarged spleen. You can see I'm already at the left costal margin. This is the left lower side of the ribs. I cannot hit any mass there. So meaning that the spleen is not enlarged. There is no splenomegaly. So you want to examine anything on the patient?
No.
No, it's all right. All right. So I told you our patient has fever and cough, and she had running nose, but the running nose has stopped. She feels weak and doesn't eat very well. She do not have stomach pain and no diarrhea or constipation. You have examined the abdomen. There was no enlarged liver or spleen.
Could you ask her if when she coughs, if it's like a wet cough or a dry cough?
She has been coughing. The cough is dry. You can see even here, anytime she coughs, there is nothing coming out. It's a dry cough.
Can you ask her what color the mucus has been from the runny nose?
All right. Let me ask the mother. You know, she doesn't have running nose anymore again, but the mother said she had it before. Wai akwai hancinta yana majina ko? Da majinan ya kalansa take? Fara ne ko? Okay, that the mucus is greenish. It was greenish and sometimes whitish.
So could you run a chest x-ray and a throat swab to check for an ARI?
All right, we have done a chest x-ray for her. There was a normal chest x-ray. There wasn't anything seen, no consolidation or patches seen on the x-ray. But the throat swab that was done was able to culture bacteria. Staphylococcus aureus was cultured on the throat swab, microscopy culture and sensitivity.
Could you also run an RDT just to make sure she does not have malaria?
RDT was done, it was negative for malaria.
Okay, so I'll diagnose her with an acute respiratory infection, and I would recommend that she takes an antibiotic, keep up hand washing and sterile techniques around.
Okay. It's all right. We are going to recommend antibiotics for her, and also going to talk to the mother on the need to clean her hands, and also ensuring hygienic techniques. Is there anything you want to do also on this patient?
You could run a blood culture to check for typhoid fever.
Yeah, we did a blood culture and it was negative there was no bacteria that was cultured on the blood culture. You did very well, Dr. Alex. I think you were able to correctly diagnose the problem of this patient. You know, she presented with fever and cough, and you were able to examine the patient looking for spleen or liver in her. You also wanted to know whether she has anemia or not. That is very good. You went further to do investigation. A throat swab was positive, which revealed bacterial growth. RDT was negative, blood culture was negative. Her hemoglobin was 12.6 grams per deciliter, meaning that she has no anemia.
Okay.
Which is fine. Yep. So you have treated her with antibiotics. You have recommended prevention for her, which is very important so that she doesn't come back with this infection. You can also as well recommend immunization. She could be vaccinated,
Yes.
Yeah, so that she doesn't come back again with the same infection. So
Mm-hmm.
that's very good, Dr. Alex.
Okay.
Our patient feels so glad and feels so important that a person is coming all the way from United States of America to diagnose and treat her.
Okay. Could you thank the
Yeah,
Could you thank the
hell,
patient and let her know that I hope she gets better?
all right, you okay? You want to tell the mother? Okay, should we tell the mother that
Yeah.
you want to tell her that you want her to, you pray for her, she heals, she heals quickly.
Yes.
Wish her quick recovery.
Yep.
Okay, wai yana cewa yana muku wai murna, yana mutuka yana muku addu'a Allah ya sa ta warke da wuri. All right, she's saying thank you. Mun gode. Thank you very much. It's nice having you today. It's our pleasure.
All right. Thank you.
All right, bye bye.